When I entered high school, I left to play basketball and joined the basketball team. It was a good team in a good school, and I was a good player. But before the season started, we had to tell the coach I had hemophilia so he knew just in case something happened. I'll never forget that meeting in his office. When my mother told him, he simply said, "Sorry, but it won't be possible for Mathieu to play on the team." He said it like a banker refusing a loan, but those few words changed my life. I realized that day having hemophilia would affect how people perceive me and would prevent me from doing what I wanted. I decided I would not live as a hemophiliac. Throughout my teens and young adult years, I did what I wanted and hid my illness from others. I bled regularly in different joints, causing long-term damage and even sometimes in muscles, which was very painful. After high school, I went into cooking school and worked in the restaurant business for some years while starting a BA in French literature, which was my other passion. Towards the end of my undergrad degree, I got a bleed in my left ankle driving to work one morning. I drove standard, and working the clutch gave me bleeds because I was not treating properly. I decided to still do my shift because my employers did not know I had hemophilia and I was scared to lose my job. I spent the whole 8-hour shift trying to hide my limp, which got worse and worse every hour. It was incredibly painful and very frustrating. Any other person would just be able to work their shift, but hemophilia always catches up with you, no matter how much you try to ignore it. I barely made it home that night because it was too painful to use my left foot for the clutch. That night, lying with my foot up on the sofa, I realized that I couldn't ignore hemophilia anymore. I had to find a different way of living. Over the next few months, I got involved with the Canadian Hemophilia Society. I slowly became more aware of my illness and began using an app called MyCBDR. It gave me the tools to manage my condition as if I was in the driver's seat. I went from suffering hemophilia to managing hemophilia. MyCBDR allows me to keep track of the quantities of medication I have, the number of bleeds, and produces charts and graphs that help me look at my disease from a reflexive standpoint. I feel like I am finally in control. Today, I work full-time with the Center of Excellence on Partnerships with Patients and the Public to use my experience to help improve the healthcare system. With the Canadian Hemophilia Society, I advocate for digital health tools like MyCBDR and am testing new apps that will provide patients with even more precise control of their health.